Calling all beauty seekers, listen up. I'm going to show you why the secret to a youthful upper face begins in the temples, and replacing lost volume to this area is incredibly impactful and a critical component to beautifying your eyes and balancing your face.
Temples are very unique. They're not something that sags like jowls, and most people wouldn't look in the mirror and think, I could really look more youthful and attractive by treating my temples. Sometimes people feel temples are unnecessary to treat because they wear bangs, or sometimes they say, oh, I can just cover them up with my hair. It's rare when someone comes in wanting to treat their temples, but
when we lose volume to our temples, it can make us look substantially older. And in the last few years, temples have been identified as one of the most compelling areas to treat.
It can even expand your hairstyling options as it did for me, so I'm going to share my story and results of how treating my temples really helped rebalance and restore a more youthful contour and brought back more beauty to my eyes.
We'll discuss who are good candidates, find out where you are on the temple hollowing scale.
I'll show you real patient results, and I'll also share with you why I currently use Sculptra over filler to treat temples.
And we'll also discuss what to expect after your temples are treated, so stay tuned. Our temples encompass the areas on the sides of our eyes. Vertically, they extend from our cheekbone or zygomatic arch to our temporal fusion line or ridge. The temporal ridge is the bony ridge that separates the temple from our forehead, and horizontally, they extend from the lateral orbital rim or the outer edge of our brow bone to our hairline. The appearance of our temples play a crucial role in shaping both the beauty of our eyes and the overall contour of our face. In our upper face, the center of beauty radiates from the eyes, and having fullness to our temple region helps accentuate this. If we split the face into vertical fifths, each vertical fifth represents a portion of the face's width. A youthful face depicts a width of 5 eyes across. When we're young, our temples are fuller, and this fullness helps to give our upper face a more rounded, soft, youthful contour. And this is especially significant for women because women have more softness to their upper face because of a more rounded, less prominent brow bone compared to men. And if you watch my other videos, you would know that the frontal bone or brow bone is the most sexually differentiating or the most sexually dimorphic bone of the skull that helps distinguish males from females. Full temples also help provide a smooth transition from our forehead and eye area to our cheeks. So what happens as we get older, and how do those changes affect the beauty of our eyes and our facial contour? With age, our temporal region loses fullness, resulting in a decrease in bitemporal width. Bitemporal width is the distance between our temples. When this happens and we lose bitemporal width, the eyes become less of the focal point. Loss of fat in this region can be dramatic. The temples have been reported to incur the greatest percentage of volume loss in the entire face. This takes away from our youthful softness. One of the first things you'll start to notice is that the underlying skeletal structure becomes more apparent, and you'll start to see the temporal ridge has more definition. Eventually, it can lead to making our lateral brow bone look more prominent and heavier, as the volume that once softened and framed the eyes diminishes. A lot of times when we lose volume to our temples, we also lose volume to our lateral cheek or preauricular area. And when we lose volume to these two areas, it isolates the cheekbones, making them more prominent, which can give our face a harsher and more angular look.
This actually happened to me, and I'm going to share my story and pictures later on.
Loss of volume can even alter the shape of the face. Actress Rosario Dawson had a fairly square face when she was young, but loss of volume to her temple region has made her heavier and more dominant to her lower face, making it a little bit more pear-shaped. Sunken temples can also exacerbate crow's feet. So what can revolumizing our temples do? Revolumizing the temples can help to reestablish the upper face dominance, which is the hallmark of youth and beauty. This is before and after 1 vial of Sculptra, and if we isolate her upper face, which side looks more youthful? It's very subtle, but you can see adding volume to her temples accentuated the beauty of her eyes by softening the contour of her upper face. And her eyes actually look ever so slightly more lifted because the temples help give our lateral brow support. Additionally, it also served to help balance her upper face and her lower face because the slight hollowness to her temples contributed to the appearance of a wider lower face, like what we spoke about with Rosario Dawson. What commonly happens when we lose volume to our temples is it creates a shadowing. You can see her lateral brow bone and temporal ridge are more prominent, which is an evident sign of aging to our upper face. Now, this is immediately after we treated her temples with Sculptra. I'll share her actual results in a moment, but I just wanted to show you an example of how treating the temples can help soften the look of the brow bone and conceal the sharpness of the temporal ridge, which contributed to a more healthy, youthful look, and the increased volume reflects more light and brightens her upper face. This is her actual result after having just 2 vials. This is 3 or 4 months after she was treated. You can see her temporal ridge is softened and she looks more youthful. She's more tan in her after photo because of the time of year. It was summer. We also treated her lateral cheeks or preauricular area.
The thing I love about temple treatment is that it can make someone look softer, younger, brighter, more lifted, and no one else can tell what was done.
Asymmetry hits harder as we get older, becoming more pronounced, and usually one side of a person's face ages more than the other side. Here's an example of someone treated with Sculptra, and you can see less asymmetry after his treatment, and his lateral brow looks more lifted. His eyes look softened, and you can't see as much of the bony architecture of the brow bone. So, who is likely to get hollow temples, and who are good candidates?
Almost all of us, female and male, will most likely eventually benefit from treating our temples, especially females as mentioned before.
But if you fall into the facial aging category of sinker as opposed to sagger, you are more prone to getting hollow to your temples. People who have a low body fat and who are very athletic and do a lot of cardiovascular exercise tend to lose a lot of fat in both the temples and the lateral cheek. Those who have a diamond face shape will also notice this even more, as well as those who have naturally prominent cheekbones. In the aesthetic field, we have a term called peanut face, or the peanut face silhouette.
So I fall into the facial aging category of sinker. I'm lean, I work out a lot.
And when I started losing volume to my temples and preauricular area, my cheekbones isolated themselves and they became very sharp.
My colleague at the time who injected me with Sculptra was like, oh my God, Emily, your cheekbones are like shows. I always had a heart-shaped face, but I was heading more towards a diamond-shaped face. I remember the first time she put a generous amount of volume in my temples with Sculptra. We had treated my temples before, but this time it was with a generous amount because we have the saying, which is that the temples are like a black hole. They can take a good amount of volume. And after, I felt like it really enhanced the look of my eyes so much. I remember I was traveling to Miami at the time and I couldn't stop looking in the mirror thinking how much more softened my upper face looked. And I was just thinking to myself, oh, this is gonna be gone in 3 days because the results you get immediately from Sculptra are not your true results. It's from the water, which will get reabsorbed in a few days. But
I've been treating my temples for years now with only Sculptra, and I've never gone back to baseline, to those harsher contours. And it really helped bring back the balance of my facial frame because the temples frame our eyes.
I did feel like I was heading towards the peanut face silhouette, and I always felt the need to pull my hair back off of my face to balance out my sharp cheekbones. So it really helped me understand how crucial this area is to treat. It's like the fountain of youth, especially for those who are really active and very lean and work out a lot.
So are you a good candidate for temple treatment? This can help give you an idea if you may benefit from treating your temples. 0 is when you have no hollowness. 1 is mild. There's a shallow depression or concavity with minimal volume loss, and the temporal fusion line may be visible. 2 is moderate. There's moderate depression with moderate volume loss and moderate prominence of the temporal fusion line. 3 is severe, which means you have deeply recessed and sunken appearance to your temples. There's marked prominence of the temporal fusion line and zygomatic arch. If you are mild, you may want to consider treating your temples. If you're a moderate or severe, you're likely a great candidate for treating your temples. Who isn't as prone to temple hollowing? People with round faces tend to have fuller temples, and if you're East Asian, you may also be more likely to have fuller temples. And this is because people with round faces and people with East Asian ancestry tend to have more facial fat, and the buccal fat pad plays a big role because it extends into the temple area. And this was discussed more in depth in this video on facial fat and attraction, so be sure to watch that after if you haven't already watched it. The temples are considered a more risky area to treat, and this is the reason why I prefer to treat temples with Sculptra instead of filler.
A lot of people use filler to correct temples, and you can get a nice correction to the temples with filler, and the results are also instant with filler. And you're gonna see companies get FDA approval to treat the temples with filler. Allergan's currently finishing up their clinical trials to get Voluma FDA approved to treat the temples. So right now, treating the temples with anything is considered off-label. Anytime you get fillers or biostimulators, rare complications can happen, like occluding or blocking a blood vessel or even blindness, which is extremely rare but can happen. But with a biostimulator like Sculptra, there's less of a risk of these things happening because it doesn't have the same thick consistency as fillers, so it's less likely to occlude a blood vessel. Another reason Sculptra has a better safety profile than others on the market is because aspiration is more reliable.
Aspiration is a safety step, which is when we pull back on the plunger of a syringe in an attempt to ensure that we're not in a vessel. If you're in a vessel, the hub of the needle will flash red.
Because Sculptra is close to the consistency of water and will more likely flash with a red reflux of blood if you're in a vessel, and sometimes in areas other than the temples, the entire reflux of blood will go past the hub of the needle into the actual syringe, and it's even more obvious that you're in a blood vessel.
But with filler, it's more viscous because it's a thick gel.
So it's less reliable of an indicator for getting a reflux of blood if you're in a vessel. Aspiration is not 100% reliable, nothing is, but it's a good safety measure to practice when you're in a place like the temples.
Here I am injecting her temples when a flashback happened with Sculptra.
Dr. Tim Pierce recently released a video on hair loss, otherwise known as alopecia, as a newly reported complication of fillers following the posterior temple lifting technique. The posterior injection technique is done further back in order to try to reposition and lift the soft tissues of the mid and lower face. But the complication of hair loss sheds light on the fact that the temples and scalp are a very tight compartment in general. So when you add volume to this area, it makes the compartment even tighter and it adds more tension on this already tight space. As the article quotes,
"The proposed explanation of the lifting effect of the bolus of a filler placed subdermally in the posterior temple is a change in the tension within the tight superficial system."
So the tension from the filler is what's thought to reposition and lift the soft tissue. Think about how much pressure you're putting on a temple with filler. It's a thick gel, and it'll be sitting in the area for several months.
The article states the cases of hair loss occurred from these types of products: fat, hyaluronic acid, which is the most popular constituent substance used in fillers, and calcium hydroxyapatite, which is Radiesse. The STA, or superior temporal artery, can be compromised by the increased external pressure induced by the filler's bolus and post-procedural edema, which means swelling.
The temples can take a lot of volume to correct. We said earlier, the temples have been reported to incur the greatest percentage of volume loss to the entire face. And in order to get a good correction, it can require treating with a generous amount of volume, which is why I said the temples are like a black hole. So what I commonly do if someone needs a restoration to their temples, I'll frequently separate their sessions. So instead of doing 2 vials in one treatment session and being limited with how much we can put in your temples in one sitting because it's a tight area, and we don't want to add too much volume at one given time because that would mean more pressure in an already tight area, what I commonly do is I'll have the person come back for their second vial a week or 2 later. That way, I'm able to get more total volume into their temples than if we had used 2 vials in one treatment session. Remember, 1 vial can treat multiple areas. So you're not just gonna treat solely temples, you're gonna treat other areas of the face as well. Another reason I prefer Sculptra over filler to treat temples is I've had my temples done with filler before. Several years ago, before I discovered Sculptra, I treated my temples with Radiesse. Not hyperdilute Radiesse, just Radiesse, which is a very thick, robust filler. And while the results were immediate and it did add volume to my temples, I didn't love the way it felt. It just felt strange and weird.
Even this Real Self article states filler in the temple region feels strange.
Comment below if you ever had your temples treated with filler. Did it feel weird or strange to you? With Sculptra, your skin produces its own collagen, so it feels natural and it didn't feel weird to me. The better safety profile coupled with the long-lasting results are the reasons why at this point in time, I currently use Sculptra to treat temples.
Another reason I prefer Sculptra is because, as mentioned before, when people are hollow in their temples, a lot of times they're hollow in their preauricular area, and Sculptra really spreads nicely in this area. It's normal to feel sore after treating your temples with filler or Sculptra. The temporalis muscle works in conjunction with the masseter muscle of the jaw to open and close the mouth when we're chewing. So injecting deep into this area can cause temporary pressure, leaving it achy and making it harder to open your mouth or chew for the first few days.
If you want to know when you should start Sculptra or you want to learn more about Sculptra, be sure to watch these videos.